Hi, I'm Jung Gang-won, a vascular transplant surgeon at the Catholic University of Korea Bucheon St. Mary's Hospital. Today, we'll learn about varicose veins. To explain varicose veins, first we need to learn about blood flow in the legs. The veins in the legs are passageways for the blood to go into various parts of the body. That includes the kidneys. There are valves inside the veins, and these valves do the job of blocking the reflux so that blood goes up to the heart. But if they don't function correctly, problems arise. To put it simply, if you're out there standing for a long time, the blood that flows from the heart flows and then stagnates on the veins in your legs, and this type of action causes certain symptoms. Swelling in the legs, feeling incredibly heavy, maybe even getting the feeling of insects crawling on your skin when you're standing for a long time, and let's not forget getting symptoms of fatigue quite quickly. If it progresses any further, symptoms of protruding blood vessels may occur. The cause is known to be quite obvious, but first of all, you can also check if there are any family members of yours with a history of varicose. It is said that children and descendants of people with varicose inherit it. Another factor could be related to your job. To be clearly specific, we're talking about jobs in which you stand still for several hours a day, and even jobs where you sit still for too long. This eventually leads to swelling of the veins. It's said that varicose veins like this occur easily. It's also said that varicose veins can occur if you're a habitual wearer of skinny jeans or tight pants. Another thing to note is women are more likely to develop it than men, especially among women who are pregnant. And among those, women who have been pregnant multiple times are more prone to varicose veins. Usually, if a person's varicose veins are left untreated, it eventually progresses to a disease called chronic venous insufficiency. That is where the state in which the legs continue to be inflamed and the symptoms continue, and we're left with venous hypertension in the legs, which is connected to chronic venous insufficiency. Discoloration then becomes another symptom. Along with that is pigmentation that occurs on the skin. Another issue is itching, and when itching is involved, an ulcer is formed. If the ulcer progresses, the resulting wounds may not heal well, and these things may progress. However, this doesn't happen immediately, so you better be keen on noticing these kinds of symptoms. Because if you see these symptoms quickly, when your legs are heavy or your blood vessels are ruptured, the best course of action is to seek treatment from a specialist right away. Treatments, they vary. So, in order to diagnose varicose veins properly, first, we run an ultrasound in order to measure the reflux time for the veins. If regurgitation time is more than 0.5 seconds, varicose veins can be diagnosed. But fear not. Not all varicose veins patients need surgery. Proper judgment from a specialist is required. Depending on the severity of the symptoms, the specialist can discuss options with the patient, be it surgery or other treatments. There are two main methods of surgical treatment. The first method is the method of stretching the blood vessels by opening them, and the second method is endovascular treatment. There are many ways to approach the endovascular treatment method. We have one that involves heat, namely a high-frequency laser. And recently, such bond technology is well developed, and surgeries as well are being developed to block blood vessels. In the case of bonding, an ultrasound is used as a guide to puncture the regurgitated blood vessels. The regurgitated veins that are being targeted are the great saphenous vein and the small saphenous vein. The method in which the backflow of the blood vessel is blocked is due to a chemical reaction between the drug used for the treatment and the blood itself when it is administered by a strong bond component called cyanoacrylate. The operation itself is quite simple, and there aren't many complications to watch out for. But of course, one has to watch out for allergies, as you might be allergic to the drug used. There may be symptoms such as itching at the surgical site or on the feet, and even possibly a burning sensation, but most of these symptoms improve. If symptoms don't improve, it's recommended to consult a specialist as soon as possible for drug treatment. And that's what we've learned today about varicose veins. Thank you.